Family Dentistry's live production here. It's like a play. No, I'm just kidding. But we're going to talk today about urgent dental care needs when time matters. And I'd like to welcome you all. Thank you so much for joining us. My name is Dr. Rebecca Himm. I am the owner of Himm Family Dentistry. I am a third generation dentist. This was my grandfather's practice before me, then my father's, and now it's mine. I am so glad to be here with all of you, giving you some wonderful information on how to help yourself take care of your teeth in some urgent situations. I'm here with my associate. This is...
Hi, I'm Dr. TJ Thews, first generation dentist. I joined the office about a year and a half ago. Met a good number of you, hoping to get to meet more of you, although hopefully it's not due to any of the situations that we talk about today. But nonetheless, I hope that you find this information useful, and hopefully if you do encounter a dental urgency in the future, you'll be more well equipped to handle it.
Yeah, and the reason we are titling this urgent dental care is because when I originally thought of calling it dental emergencies, I looked up the American Dental Association's definition of a dental emergency. And a true dental emergency is something that is potentially life-threatening, that requires immediate treatment. It involves severe pain, trauma, severe bleeding, things that restrict your airway, and all of those situations, severe infection as well, I forgot to mention that. All of those situations absolutely require you to call 911 or to go to your emergency department and seek care immediately. None of those should be calling us. You should be calling call EMS. We need you to be taken care of and immediately. And we don't want, hi Gary, nice to see you.
Thanks for joining.
We don't want anyone to ever be in those situations, but we do want to give you that information. So on that note, we will be talking about urgent dental needs. Those do involve pain. They do involve knocking out your teeth or breaking your teeth. And we have created an at-home dental first aid kit to help you with some of these situations before you call us or if you can't reach us immediately. So we will be giving away 3 of these kits at the end of our live. And how do they win one of those, Dr. TJ?
You do that by leaving a comment, so you can ask us a question or anything while we're presenting, liking the post, and hopefully sharing it with friends, family, to also spread some good information to them.
Well, thank you. Yeah. All right. On that note, I'm going to hand it over to Dr. TJ, and he's going to tell you about one of our most interesting dental urgencies.
So what we're going to start talking about is in our world called an avulsion, or what most people would call a knocked out tooth. It's most common to happen to your upper front teeth and in kids ages 7 to 11, with a not surprisingly twice as common occurrence in boys as girls. Most common causes of this include falling, bicycle accidents, contact sports like hockey, football. A lot of people don't think of it, soccer, lacrosse. And one thing to remember with those contact sports is the helmets are not doing anything to protect your teeth. So parents, kids, whoever's playing sports, please get yourself a mouth guard and protect yourself so that this does not happen to you.
Yes.
Before we fully get into the knocked out tooth and how to treat it, I do want to make sure we go over some less extreme instances of injuries that can occur to teeth and how we would help you treat them, or what steps you should take if they occur to you. The first one is called a concussion, so it's not just your brain that can get concussed, your tooth can also get concussed. In these situations, it's usually going to be some sort of hit, whether it's an elbow, basketball, soccer ball to the face. The tooth in these instances is not going to be loose, but you will probably feel tender when you touch it or when you bite into anything. More than welcome to give us a call and come have it evaluated, but in these instances, we're generally just going to tell you to eat softer foods, avoid overworking that tooth, and just try to, be as gentle as you can with it. We'll monitor you for, a couple weeks up to a month after, make sure there's no lasting effects to the nerve, but there's nothing that you need to do in the immediate instance after one of those. Another type of injury is called a subluxation, just one step up from a concussion, where in this case the tooth has not moved from its original position, but you will notice that it's a little bit loose or wiggly when you go to touch it or bite into anything. In these cases, we will probably splint the tooth for you, which involves placing, whether it's a ribbon, a metal bar with some bonding material just to support the tooth, prevent any further damage. External luxation is where the tooth has been popped up but is not fully out of its socket yet, so a lot of times it'll be present as one tooth looking longer than the other. If you have saline on hand, it is good to get it rinsed with saline, rinse the root surface that you can see, and try to position the tooth back into place. Then come see us. If you're too nervous to do that, you can come see us. We'll reposition it for you. But in any of these injuries, the quicker that you can get the tooth back to its original position, the better long-term prognosis that you have.
Yes.
Fourth type of injury is the opposite of what I just told you. So an intrusive luxation, where the tooth gets pushed into the bone. There's actually going to be a little bit of a fracture of the bone at the tip of the root, allowing the tooth to get pushed in. Come see us as soon as possible. If the injury is minor, and what I mean by minor is less than about 7 millimeters of tooth intrusion, what we're generally going to recommend is to observe that tooth for the first month, because in a lot of these cases the tooth will erupt back into its position, at that point we would then splint it for you so that we can restabilize it and keep it healthy. If it is more than that, it may require surgical replacement, and again, anytime we're doing surgery like that, we're going to splint the tooth for you to make sure we keep it stable and healthy. The fifth and most extreme of these injuries not involving a full knocked out tooth is a lateral luxation. In these cases, there's actually some bone breakage that has allowed the tooth to now be displaced either left or right, away from its position. We often in these cases need to remove the tooth and replace it with forceps for you to get it back into the proper position. In these cases, you're also going to be splinted, usually a little bit longer. Those smaller injuries, it's generally a 2 to 3 week splint. If we're doing surgery to reposition a tooth, it's going to be closer to a month at least. And in all these cases, you're going to have follow-ups at 2 months, 3 months, 6 months, because we want to make sure that even though the tooth's back into its original place, we have to monitor the nerve health, because a root canal is a very common need when you have any of these injuries to teeth. So kind of switching back to avulsions, when the tooth is fully knocked out, first thing to do is find the tooth. Can't put it back in if we don't have the tooth. If you cannot find it, please go to the ER to make sure they can evaluate you. They may need to take a chest x-ray to rule out swallowing or aspirating or getting the tooth into the lungs. When you do find the tooth, only grab the crown or the white part of the tooth if you're unfamiliar with what the crown would be. Any handling of the root can introduce foreign materials, bacteria that can severely diminish the chances of your tooth surviving this incident. If possible, you want to rinse the tooth, ideally with saline, but water is fine if that's all you have available. But do not scrub the root, because you actually can scrub off some of the cells that are still present on the tooth that will help it reattach when it gets back into your mouth. If you're not able to replace it yourself, you want to store it in a sterile saline. If you don't have that, milk is okay. But you want to absolutely avoid tap water. Tap water's got minerals and ions in it that will actually speed up the dying process of the cells and will, again, make the future prognosis of the tooth much, much worse. Couple main points just to reiterate there. Immediately getting the tooth back in is ideal, less than 5 minutes, but under 30 minutes has been shown to have pretty good prognosis. From 30 to 60 minutes, still okay, but getting worse, and longer than an hour is, I mean, we're still going to try to get it back in there for you, but there's almost certainly going to be some immediate treatment needs in those cases.
And know that if you do call and it is an urgency like that, please tell us right away, because we are going to want to be set up by the time you get in so that we can put you right back in that chair and try to save your tooth for you.
Absolutely.
Yeah, for sure.
And not going to come as a surprise to most of you, I would assume, but after any of these types of injuries, we're probably going to have you on an antibiotic, especially if the tooth was fully knocked out. We want to make sure that we don't get any sort of infection from replanting a tooth that may have come into contact with any bacteria or foreign objects. And we're going to recommend a softer diet, which you're not going to be wanting to do any heavy chewing with a tooth that was freshly knocked out anyway.
No, not at all.
Well, as I think we all know, teeth are not the only tissues in our mouth. So while we can have injuries to the teeth, it's also possible to have some soft tissue injuries. The two most common are going to be lacerations or cuts, and then abrasions, which you can think of more of like a scrape or sort of those sores you may get if you have dentures from a poor fitting denture rubbing, the cuts or scrapes you can get on your lips, your gum tissues from orthodontic brackets and wires. Hopefully not too many of our patients out there are doing this, but chewing tobacco can leave abrasions and things like that.
Please don't.
So what to do in these cases? First thing you want to do, again, is rinse with a sterile saline to try and just clean the area so that you can kind of observe it a little bit better. If it's a very deep cut where you can see tissues kind of spreading apart, or there's, severe bleeding, as Dr. Beck mentioned earlier when we started this presentation, to please call the emergency room and get seen as soon as possible, because that is a true emergency.
Hi, Kim.
Thanks for joining. However, if you rinse and it's not too deep of a cut, or you see it's just a small little scrape, if there is a little bit of bleeding, what you want to do is take some gauze and apply some good pressure to that area for, at least 15 minutes, but really until that bleeding has stopped or has slowed to a very slow drip. Cold compresses are going to be very, very helpful to alleviate any of the swelling. And by keeping that swelling down, we're usually going to slightly keep the pain level down.
Yep.
Once you've got the bleeding stopped, it's not a bad idea to come in and see us. Just have us evaluate the tissue. We'll keep you on a little follow-up to make sure. We want to monitor for any signs of infection, swelling. Any pus would be a bad sign and something you want to be evaluated for an infection very quick. And also trouble breathing. Anytime you have trouble breathing, please call the emergency room. Get seen immediately. That's not something to play around with or risk your long-term health with.
No.
Additionally, beyond those, some reasons to seek immediate care. If it's an animal bite, even if there's not significant bleeding, you want to go be evaluated and make sure there's no infection from that. We don't want you guys to get further sick from these by taking a chance staying home. And then just again, those deep, really deep, heavy bleeding wounds, please be seen immediately, because it is something that needs to be addressed if it's going to be bleeding for a long time.
Yeah. And one of the things that can create those abrasions or lacerations from trauma, it can also cause broken teeth. So you can get a traumatic hit. Maybe it's just an elbow, maybe it's you tripped, maybe you were in an accident somewhere and your teeth break, and they can puncture through, things like that. So just like Dr. TJ said, in the case of that, you're going to rinse your mouth with ideally sterile saline, which will be in the kit. But if you don't have that on hand, that's fine. What you can do is make your own saline solution to rinse your mouth out with. If you have distilled water, warm up some distilled water. It's 8 ounces of water with a half a teaspoon of salt. You're going to mix the salt until it's dissolved, and then you can use that as your saline solution to rinse your mouth out with. But yeah, so other causes of breaking teeth, I mean, that's a pretty common urgency for a lot of people, is you can bite into something hard and it can crack it. You can have a cavity that's underlying that you haven't had diagnosed yet, and it can cause a fracture to your tooth in the enamel. And, you know, and like I said before, probably the biggest cause of really bad broken teeth is going to be trauma. So there's different levels of breaks. For most breaks, you are going to want to call us and get seen as soon as possible, even if it's just for aesthetic reasons. But a lot of times the break of a tooth leaves very sharp edges. Those sharp edges, even if they don't initially cause some type of abrasion or laceration, can long-term cause that. I've seen some pretty wicked sores on the tongue from a broken tooth, even after a day. So again, dental urgency, you're going to want to give us a call as soon as possible and get yourself in here. Some things you can do at home to help with it. You can use a temporary filling material to fill the break, and it will kind of cover and protect if the nerve is exposed, and even if it isn't, it will help smooth out some of those really sharp edges. You can use dental wax for orthodontics, and you can put that over the broken area until you can get in to see us so we can take care of that need. So both of those are going to be things that help prevent further breakdown of tissue, further lacerations, things like that. Same thing though, you're going to want to start with rinsing with warm salt water after a break. If you can, you're going to want to save the toothpiece if it's a big break. You're going to want to put it in a container with sterile saline or worst case scenario, milk if you have it. It's not quite as urgent as if you popped your whole tooth out, but it does help to have a sealed container with that piece. So if we can use it to help fix your tooth, we will. And you're going to want to bring it here as soon as possible. Yep, that would be the basic thing that happens with a break. What would happen if you leave it long term is the same thing that could happen if you leave a cavity long term, or you leave gum disease untreated long term, is that bacteria can enter into your body, into your system, and create a dental abscess. So, you know, I went over a lot of those periodontal bacteria last time, and I actually had to relook them up because you know what, those names sometimes
long Latin,
yeah,
hard to retain.
And we talked about this last time before we went over it, but we always did nicknames when we were in dental school to remember it because a lot of our tests were multiple choice, so we have to remember how to say certain bacteria. But when I'm going to pull this up here, it's not really a pull up. I'll figure out eventually how to add actual graphics to these lives, but in the meantime, can we see this? Mm-hmm. Yeah, okay. In the meantime, we have our new classic graphic here. This is your tooth and the tooth apparatus, the periodontium, if you remember that. And this is a sample of an abscess caused by a cavity or a bacterial infection from a cavity. So a cavity is when bacteria in your mouth, Streptococcus mutans in particular, eat the sugars that are present and they release acid as a byproduct. That acid eats into the hard surface of your enamel and then into the inner surface, which is our surfaces, which are a little softer, and it leaves behind all the dead tissue. When those bacteria get into the live part of your tooth, the pulp here, then they start to kill off your nerve and your healthy live tissue. Now, your body has nowhere to put those cells, okay? So what it does is it tries to get rid of all that dead stuff by pushing it out the bottom of your tooth. Over time, it sends all those fun cytokines and messengers to your brain, and the brain sends stuff back to help wall off the infection and try to get rid of it. So it has cells that create a cyst around the bottom of your tooth, and then all the dead bacteria are inside that little cyst. And that creates pressure because we don't have a lot of space in our mouth, and this is all bone around here, so it creates pressure. That pressure ultimately leads to the resorption of the bone, and then you get a swelling. So you may be feeling, for some people, every toothache is a little different. At this point, you're feeling a pretty severe toothache, but it may start with something as simple as, oh, I'm having a hard time drinking cold, or, oh, I'm having a hard time drinking hot. Every time I drink something hot, my tooth hurts for like 22 minutes, and then it starts escalating. Well, that's because this is getting bigger and bigger and bigger, and the infection is growing and growing and growing. So this is definitely a dental urgency. If you start to see any swelling, even if you don't feel anything, but you start to see like a pimple or white pus coming out of your mouth in any way, shape, or form, that is definitely something you want to come and see us for. What we're going to do is assess the situation, take an x-ray, see how significant that infection is. We are most likely at that point going to put you on an antibiotic, and we are going to recommend the proper treatment to rid you of that infection. Now, if a cavity bacteria has gotten all the way down in here and your nerve is dead and dying or dead and dying, you are going to need a root canal, or you are going to need this tooth taken out to clear your body of this infection. At this point, it is not an emergency. However, there have been instances of dental abscesses that have grown so big so fast that they do block your airway. If that is the case, I know we sound like we're repeating ourselves, but please go into your emergency department, get seen as soon as possible. That is definitely life-threatening. And there are stories out there, which I did not bother linking or looking up, but there are stories out there of people who have died from dental abscesses. So it's an urgent situation. It's something you don't want to leave on your own. If your tooth breaks or you have a cavity that you can't get here urgently, but you don't have an abscess, you can put a temporary filling material in there. You can cover it, like I said, with wax, and then call us and get yourself seen as soon as possible. And for any pain that's occurring because of abscesses or things like that, you're going to want to take an over-the-counter anti-inflammatory. The best one for dental issues is typically an ibuprofen or a Motrin. You're going to take 600 milligrams every 6 hours, not to exceed 2,400 milligrams in 24 hours. And if you can't take a Motrin, typically we recommend a Tylenol. Now, the limits for Tylenol are slightly different depending on your health needs, so you're going to want to double check with your medical provider, but typically you want to try to stay under 4,000 milligrams. If you have any other medical issues, you want to stay under 3,000 milligrams. So you can take 500 milligrams to 1,000 every 6 hours, depending on your particular health needs. So you're also going to for any discomfort or pain for an abscess, you're going to use a cold compress. You can use the cold compress on your mouth on and off for 20 minutes on, 20 minutes off. That's going to help reduce the swelling and help the pain there. You can rinse with warm salt water, like we said, and that will also help remove some of the excess bacteria and help some of it, alleviate some of it. But ultimately, in the end, you are going to want to call and get yourself an appointment so that you can be seen and taken care of as soon as possible. All right, I'm sorry, Dr. TJ, I think I just took over your little,
you're good. And
little pain section there.
I may have missed it, but it's also worth repeating if you said it, and that may just be me missing it, but do not try to pop your abscess.
Oh no, I did not say that. Thank you for saying that, yes.
If it starts draining on its own, that's different. You don't want to go in there with your hand and try to pop it. We're actually not supposed to pop pimples on our face as frequently as we do, but you definitely don't want to go trying to pop anything in the mouth and introducing foreign bacteria, anything that could get in there and cause the abscess or infection to get even worse.
Yeah, well, and also the reason we don't do that is because we don't have the back valves in our facial blood vessels. Sorry, in our facial vasculature, so it could go directly to your brain if you fool around with it. So yeah, don't fool around with it that way. That's not something you want to do. Thank you for catching that for sure. All right. Do we want to go over the things in our kit that kind of deal with these urgent cares?
Yeah, let's go ahead.
All right. Okay, so first of all, we have a handy dandy, you want to lift it up for me? Handy dandy little Molly bag here. It will fit everything in it, generally, and more if you really want to put a little bit of extra in there, so it's not just for one or two people, but for more. We have for the avulsions or lacerations or any of the broken teeth, we have a sterile saline that's in the kit. Obviously, it's not open, so as soon as you open, it becomes unsterile. But if you are in an urgent need, then this works. This is a big bottle. You can get smaller bottles, and you can actually get pre-filled sterile syringes, which is what I truly think is the best. But in this case, we have a container with a lid that is screw tight. You're going to want to pour the sterile saline solution into the container, tighten it up, and put, if you have an avulsed tooth, put your tooth in there. Also, then you're going to want to, if you can't get it back in your mouth, sorry. You're also going to want to rinse with this in your mouth, rinse the area out. If it's in the back in any way, shape, or form, that's kind of what the syringe is for. You can pull up some of the solution and squirt it into the area. Or if you just want to be a little more precise, you can do the same thing. So we've got those. Actually, I should have started with this. Always start by cleaning your hands. So if you don't have soap and water handy, we have included a hand sanitizer because you want to at least kill most of the bacteria on your hands. Additionally, we have an instant cold pack. As you can see, we got this particular one at Walgreens, but you can order most of these things, if not all of them, on Amazon. I will put some links into the post-show notes so that you can kind of look at that as well. Generally, you probably want to put a 2-pack in just to make sure, but that's always going to be useful for any sort of trauma and any sort of toothache. We have, for just little things, little lacerations, like the trauma related to an ortho bracket or just an accidental bite of your cheek or a stress canker sore or something like that. We have some oral, basically kind of like Oragel, everyone's familiar with that, but that's a brand name. So it's topical benzocaine that you can put on the area that's uncomfortable. It will numb it for about 10 to 15 minutes, kind of get you over some of the discomfort. We have some cotton-tipped applicators to use with that, so you don't have to use your finger. Put the gel on the cotton-tipped applicator, place it over the area, let it sit on that area, kind of like when we have to give you a dental shot. I know nobody likes those, but we've got that. We have for bleeding, for broken teeth, we have some dental wax. That's what I was telling you. You can break a piece off of this, warm it a little bit in your hands, put it over the broken tooth, and then call us. That will help protect some of your other tissue. For Dr. TJ's area, we also have some gauze that you can wet gently. If you've already opened the sterile saline solution, wet it with the sterile saline solution, wring it out, fold it, and bite on it. You put firm pressure. You don't have to bite the hardest you can bite, but put firm pressure on the area. That will help with any bleeding. Or if it's in your cheek or your lip, hold it on there with firm pressure. And what else do we have in here? Oh yes, our last thing is same thing with broken teeth or with a cavity that you need to be seen but you can't get here immediately. This is a dental repair kit, and it's basically a temporary tooth filling material. This isn't bad to have along with you wherever you go on any trip, because sometimes you just need something. You can use this to put a crown back in. If your crown comes out, you can use it to fill that hole for a short period of time. You know what I somehow didn't put out here is our floss.
Oh,
Yeah. So also included in the kit is dental floss to make sure if you get something stuck between your teeth that you have a way to get it out. And that's about it for the kit. A little bit of cotton rolls, same thing. If you find the gauze hard to get in your mouth, or you need something a little tighter, smaller space, that cotton will can act the same way. Yeah. Do you have anything to add?
Well, they would be very size specific, but it would not be the worst idea to add some gloves to your kit
Yes,
as
thank
well,
you.
but it would be hard work, especially for the giveaway. It's hard for us to guess your size.
Yes. Yeah.
But you can buy, exam gloves or gloves that you can use for this at CVS, Rite Aid, Walgreens, pretty much anywhere
Anywhere.
you can buy health items.
The other thing you might want to put in, just depending, especially if you're going to help someone else with an issue, would be a mask.
Yep.
And we can put some of those in there just to make sure you have them. But yeah, okay, great. Well, I think it might be time for a giveaway.
Sounds good to me.
Who do we have, Mindy? All right, 1, 2. Looks like we're going to have a lot of winners in our group here today.
Yeah.
Okay. Do you want to put those names in a random selector for me, Mindy?
Yes.
Also known as a hat.
What do we have?
Or a cup or any cylindrical object will do.
I failed at that. Yes. Keep talking.
We have a tooth bucket.
We do.
I guess while we're waiting, just to recap a couple of the key points. One, as quick as you can get treated or seen for any of these, again, emergencies, get to the ER, but if it's an urgency, get in contact with us. The quicker you're seen, the better. The more
Yes.
likely we are to come to the most ideal solution for you. I know none of these situations are ideal, but again, the faster, the better. Generally, it's going to be a good idea. I'm sure you're sick of hearing us repeat it, but having some sterile saline on hand, whether it's part of your dental kit, a home first aid kit, is going to be very beneficial for if you need to clean any wounds or sores or anything
Yes,
like that. For anybody who's new or does not know our phone number, if you need to get in contact with us, it is 734-421-0121. Not only for urgencies, but if you are overdue or need to establish a new dental home, regular dental visits are the best way to prevent any sort of dental emergency or urgency from occurring, because you're going to be able to get diagnosed before any sort of problem arises.
Yes, very good. Thank you. And we are welcoming new patients always, so we appreciate any referrals that you have. All right, I think you can hear the shaking here. All right, Dr. CJ, who's our first winner?
Our first winner is Kate.
All right, Kate, awesome. We will have that set for you. All right, our second winner is Christina. Congratulations, Christina. Well, Mindy might have found that third winner. I don't know, whoever fell out, right?
And our third winner is Kimberly.
All right. Well, congratulations, Kate, Kimberly, and Christina. We will have your dental emergency kits, your dental first aid kit. It's not an emergency. Remember, if it's an emergency, call 911 or go to the emergency department at your local hospital. And we will look forward to seeing you all at our next live next year. So enjoy the holidays, everyone.
We'll see those of you who have appointments this month coming up. If not, have a great New Year and happy holidays to everybody.
Remember to brush your teeth.